We got an earlier question from Kevin in Boston, and this is an issue that's getting a whole lot of attention now as there's this conversation of what do we do about school in the fall, right? We have, there's the issue of the mask, and there's the conversations about, should it be 3 feet distance, 6 feet going on about, within a school. And there are those who, parents who are saying, I'm not going to send my kid back to school. And this presents a whole host of issues for those in Black and Brown communities as well. But this question from Kevin, because of the challenges of delivering remote education equitably, I believe that COVID could be the biggest driver of educational inequality since the property tax. What can be done now about school opening in September to minimize this inequity? That's a tough question. Who wants to take that?
I'm counting to 10 because, as Adrian knows, this is the issue that gets me going right now, because I think it's the one that we're not paying the attention to that it deserves. And at the end of the day, we have to be honest that it is children who are being impacted, and that might have something to do with why this issue is not getting the attention it deserves. Regardless of what happens in the fall of 2020 with respect to buildings opening or not, we must fundamentally change how public education is delivered in the Commonwealth. We know that here in the Commonwealth, the data has been very clear that public schools in the Commonwealth are typically in the top 3 in comparison to other states. But when we talk about public education for Black and Brown children in Massachusetts, it's shameful what the outcomes are. And that was pre-COVID. Now we have COVID-19. A pandemic that has caused children to be at home, distance learning, some children with no Wi-Fi, children with no computers, children who have gone from maybe 4 or 5 hours of structured learning down to 2, 3 if they're lucky. That's a problem. And we are going to be held accountable, responsible for the adverse impact that this virus is going to have on our children's education if we don't do something different. We must. It is an imperative that we demand that public education looks different in response to this COVID-19 pandemic. This is truly a racial justice issue.
It's an enormous
so
issue.
much.
This is something that keeps me up at night. I mean, inequality in education was a huge issue already. We did a huge project last year tracking valedictorians from different schools that became the study of inequality. We've got a team that works on this now full time. And what's happened in COVID is going to exacerbate every problem schools already had. And there are no plans that I can see, let alone viable plans, for addressing any of this. They're barely talking about it. And, it's late July. So this is a huge, huge concern.
So putting that aside, and knowing that that's still a big issue, and the clock is ticking as we get closer to schools reopening, there's this question from Watertown, Michael in Watertown, who's asking. I guess he's looking for a little bit of good news here. What can you point to into a particular community, city in the state that has done a good job dealing with COVID, especially regarding Black and Brown residents? So there's a moment for any of you to speak up. Who's doing something right in Massachusetts?
So what I'll say on that is I think what I've seen from my vantage point is that the COVID-19 pandemic has absolutely mobilized the Black community in particular to try to take as much responsibility as we can for our own survival through this. And that's a bright spot. It has brought community together. It has brought community together in a way when, there was no PPE available in communities of color. Folks kind of put their nickels and dimes together to try to make sure that we had masks and face coverings in our community. As we have been moving through this pandemic, it has been people in the Black community and the Latinx community demanding that there be testing readily available in our neighborhoods, readily accessible in our neighborhoods. It has been really Black and Brown community standing up for ourselves, and in this moment, really demanding that we receive the supports that are needed to make it through this pandemic. That's a bright spot.
Dr. James, any bright spots?
I would say for healthcare, I think that in addition to everything that happened at the same time, I think it's given us more insight, or healthcare systems more insight into how something like COVID, could happen and how it could have the kind of impact people are actually doing, or how the type of outcomes it had. But people are actually doing work inside of hospitals now, having conversations, creating plans and things like that to really address the root causes of it. I think that it was a great exercise, for lack of a better way of describing it, to be prepared for the next time or for the future, or, should something else come up, but not just addressing what will happen, but prevention-wise from that perspective. So I think it's been great for us all, and from that perspective.
I want to keep the focus on solutions. Another audience member, Ruth from Cambridge, asking, how can we move forward on essential issues and not get sidetracked with tearing down every statue and renaming every building or street? Some are obvious, but our energy is best spent on moving forward rather than looking back and fighting too many made-for-TV battles. Wow. Adrian, this sounds like you're up your alley here.
Well, I don't necessarily think that these are all made-for-TV battles, for that matter. But I do think Ruth has a point, though, that this is a moment where we really need to think about what the most urgent battles are, And we're here talking about race and COVID-19, and I think it has put a focus on so many issues of inequality, and this is the time to really keep that conversation going until we reach the point of really thinking through what we're going to do about housing discrimination, employment discrimination, all the other economic and socioeconomic factors that are leading to this tragedy.
Another question from Ron. Go ahead.
I think we have to be really clear about what we mean by moving forward. And from my perspective, moving forward is about, yes, it's the conversations, but it's also the action. We have to understand that there has been a lot of work. Racism just didn't show up in May of 2020 or in March of 2020. It's been here. And there are those among us who have been working tirelessly to change policy, to bring about legislation, to help disrupt systemic and structural racism. So moving forward must include both individual action to dismantle structural racism and collective action through policies and legislation and programs. So I'm hopeful that, Ruth and others are thinking about what they can do in this moment to help us move forward in a way that is intentional about dismantling structural racism.
And isn't it this time around? I know this has been a battle that's been fought for a long time, with small itsy bitty steps forward and then many steps backward. But does it feel different this time? Doesn't it feel like at the crossroads of COVID and Black Lives Matter, that this feels like it's not going to slide back the way it has in the past? Yes,
but I think we need to slow down on congratulating ourselves on how much better we're doing now and all the momentum now. This is a long fight, okay? It's not a 2-week fight. It's not a 2-month fight. And yes, we are in a very interesting and exciting moment. But, it's going to take a lot of intention and a lot of determination and a lot of sustained focus to make what we should out of this.
Yeah. Look, we had, 6 weeks ago, we had people across the Commonwealth engaged in protesting and demonstration, just mortified to come to understand that through the killing of George Floyd, coming to understand what racism is all about, what the experiences of Black community is all about, and folks took to the streets. We stood shoulder to shoulder, said Black Lives Matter, and in those moments, I'll tell you, I was very hopeful last month, because I did see and feel something different. Today, in July 2020, I'm very concerned. I'm concerned because this is the tough moment. We see today at the State House the debate, not just the debate, the fight that is going on at the State House around policing reform. Yet 4 weeks ago, everybody was on board to fundamentally rethink how policing is practiced. Today, we are receiving so much backlash and so much pushback because today it's about making a decision. Yesterday, it was about saying something. And so I'm hopeful, yes, but I am reserving really judgment until we actually get something done. We have to do things differently this time. And while I'm willing to, and I know so many others are willing to be on a journey, we need concrete signs, that concrete, decisions being made, actions being taken to let us know that this time it really is different.
Dr. James, one of the conversations that I've heard from the medical community is bringing more people of color onto hospital boards and bringing in sort of community voices to help guide some of these potential changes that could happen within the medical community. Is that something that you're seeing and something that you support?
Yes, and we've been talking. We've been talking about that. We've been talking about that for years, to tell you the truth, because people don't know what they don't know, and you can't know what you don't know unless you have other voices at the table, to inform you. And so it's even having more doctors of color. I mean, I can remember even like being an intern and hearing the next room over, the interview being had with the patient, and I'm thinking in my head, the patient doesn't know what you're talking about, and they're not going to do that thing because I just know. I know them, right? And so it requires, more diverse minds at the table. I mean, I'm cautiously hopeful. People have short memories, and I think if we don't seize the moment and just like keep things going, keep the momentum going. And I agree with Tanisha. It's about action. It's about action. It's about getting things done. If we don't do that, I worry about what will happen or not.
I wanted to take one more question from.
We got to stay in the street, and I think that's really important. When you talk about what's changed from like a month ago to now, we got to keep the protests going. People have to stay in the street, otherwise it all goes back.
Okay, very good point. I want to take one final question from an audience member, and maybe all of you can jump in on this one. Ron from Saugus is saying, in the spirit and honor of C.T. Vivian and John Lewis, what lessons can we learn from them that can be applied to the current pandemic that we call COVID-19 and the pandemic of racial inequality?
Both of them were Reverend Dr. C.T. Vivian and Congressman Lewis were both deeply committed to community. And their work was rooted in community. It was selfless work. But there are three things that immediately come to mind when I think about the two of those giants who we lost. One is that they saw this issue of racial justice as one that is truly about humanity. This is a humanitarian fight. This is a humanitarian mission. And both of them had at the core of their work a deep love for humanity. Both of them absolutely led with courage. They demonstrated courageous leadership. And certainly during this time, we're seeing the importance, the need to have courageous leadership. This is not easy work. And then finally, both of them had tremendous humility. We are all on a learning journey. Dr. James said it. None of us knows it all, even those of us who were born in this skin and who have been in this fight for decades. None of us knows it all. And so the humility that they both displayed in their work, I think is certainly something that we can all learn from and hopefully model.
And quickly, Dr. James, some final words?
I would say persistence, and for certain humanity, as Tanisha said, and fearlessness. Just not stopping and not letting anything get in your way.
Adrian, final words from you.
When I asked John Lewis about getting arrested 40 times in the 60s, he said, "I've been arrested 5 times since I've been a member of Congress." And his point was, the fight never ends, the struggle never ends, and you have to be committed all the way through. And he was to his last breath.
All great comments. Finally, we want to hear once more from State Representative Miranda, who has a message of hope.
I think we have to remain hopeful, and we're a resilient, righteous people. We don't get knocked down easily. And I've seen countless community members come to the rescue of their neighbors. Folks like Rep. John Santiago, who's working in hospitals at Boston Medical Center and also in the State House, doing the dual duty of being a legislator and a doctor. We have folks who are really championing testing sites and mobile testing in our community. We've come a long way in 3 months, and Massachusetts, I think, was right to slow down the spread by not opening up quick enough. And now, as we're thinking about going into phase 3 and 4, I urge caution, because the communities that are going to be impacted are us. But I just say to folks that I'm with you, that I survived, that there are people every day walking out of hospitals better, and we can use that as energy for the fight ahead. And I just want to encourage folks as well, as we look at race, we cannot ignore race in anything that we're sort of working toward now, especially COVID. I know the picture sounded grim. That is our reality, but also our reality is that we have fought many things in our 400 plus year history on this land and in this country, and we'll continue to fight together.
A good note to end on. I want to thank our panelist, Dr. James. Thank you so much for all of your insights. Adrian, thank you as well for all of your comments as part of this conversation this evening. And Tanisha, of course, a lot of great examples and great points made during this conversation. I also want to thank our partners, the NAACP Boston branch, the Boston Globe, and World Channel. All have contributed to the ground we have covered here this evening. And a special thanks to the Globe for their wonderful historic photos that we used in the open to our show. And to Berkeley student Ali E for her song, you heard it, Welcome to America. That was at the beginning, the intro to our show this evening. Most importantly, thank you, all of you who are watching and will be watching this show. Thank you for all the great questions that came via Facebook and those that came in advance as well. Keep an eye out for more episodes of The State of Race coming in the fall. And before then, July 31st, another opportunity, a week from this Friday. Basic Black is coming back with a special show focused on generational activism. Again, thanks so much for joining us this evening. I'm Dan Lothian. Good night.